we will discuss the topic hypothyroidism. There are two metabolic disorders related to the thyroid gland. One is hypothyroidism, which is more common in dogs and rare in cats, and hyperthyroidism, on the other hand, is more important and common in cats. So right now we will cover hypothyroidism. Before we read more about the disease, I will tell you about the basic physiology behind the thyroid gland and the hormones. Thyroid gland secretes three hormones, T4, T3 and reverse T3 or RT3. T4 is also known as tetraiodothyroxine, which means it has 4 iodine atoms. T3 is known as triiodothyroxine and reverse T3 is just reverse T3. First of all, T4, it is the most abundant circulating form of the hormone, of the thyroid hormone. So 90% of all three hormones is T4, and out of that 90%, 99% is bound to the serum proteins. That means it is not biologically active. It's basically a prohormone. Prohormone is the hormone that's precursor to active hormone. So only 1% is free or unbound. It is known as FT4, which is free T4. And this free form is biologically active. That means this is responsible for all the functions of the thyroid gland. Like, this will be converted to an active form, and then that active form will perform the functions. Now T4 is present in the blood. It's circulating. It's a circulating reservoir of thyroid hormone. Once the FT4, that is the free form, enters inside the cell, the FT4 is converted to T3 hormone, which is the real worker or the biologically active hormone. So the function of T4 is basically just being a reservoir. Now the hormone T3, which is the active hormone, is present intracellularly only. It won't be present in the blood, because in the blood T4 is present. It is converted to T3 once it enters inside the cell. So T3 is present intracellularly, and it will act on the receptors of the cells of the body and stimulate cellular activity. That is, it boosts the metabolism. That is the main function of the thyroid hormone. The last one is reverse T3 or RT3. This is the inactive form of T3. So it is similar to T3, but there is a structural difference. And the use of this hormone, the significance is that during any illness, during which decreased metabolism is beneficial, for example, any diseased condition, during starvation or heart failure, any such situation, the T4 is converted to RT3 instead of active T3. So normally it would convert to T3 and boost the metabolism, but in certain situations it will be converted to RT3, and the result will be there will be no metabolic effects. The metabolism will not be boosted. So it will bind to the thyroid receptors but won't activate it. Now we need to know about the basic HPT axis, which is hypothalamus pituitary thyroid axis. In this case, the hypothalamus will secrete TRH, which is thyrotropin releasing hormone that acts on pituitary thyrotropes. And it will command the pituitary to release its TSH or thyrotropin. TSH here is very important. Then that TSH will stimulate the thyroid follicular cells to further release thyroid hormones, which are T4, T3 and RT3 that we just read about. So I'll give you an analogy. It's like the hypothalamus is the CEO and it will command its manager by secreting TRH. The manager pituitary thyrotropes will further instruct the workers, that are thyroid follicular cells, via TSH or thyrotropin, to ask them to release their hormones or make products. That is, the products here are T4, T3 and RT3 that are released into the circulation. Now there is a negative feedback mechanism as well. In this case, the hormones such as T4, T3, RT3, the thyroid hormones basically, can exert a negative feedback on pituitary and hypothalamus both, when there is a sufficient amount of these hormones in the blood. Similarly, the TSH or thyrotropin will exert a negative feedback mechanism when there is sufficient amount of TSH in blood. So the thyroid hormones as well as the TSH, thyroid stimulating hormone, they act as the quality control in the factory. They can report back to the CEO, to the manager, to stop producing more hormones. They will send a message to the CEO, the manager, the workers, that is hypothalamus, pituitary, thyroid follicular cells, that we've got enough stock, so you need to stop producing more. That was all the normal physiology behind the thyroid gland and its hormones. Now we will discuss about the disease hypothyroidism. It is most commonly seen in large breeds. For example, Doberman, Golden Retrievers. These are certain breeds that are more predisposed to this disease. Primary hypothyroidism, which is due to a problem in the thyroid itself. It is most common, and the causes are lymphocytic thyroiditis and idiopathic atrophy of the thyroid gland. So we don't need to remember the exact causes, but most hypothyroid diseases that we encounter are because of a primary issue in the thyroid gland itself. Secondary hypothyroidism is due to the failure of pituitary thyrotropes to develop, or because of their dysfunction. So basically there will be impaired TSH secretion in case of secondary hypothyroidism. Now the clinical signs that are suggestive of hypothyroidism. First one is general metabolic signs. Since the thyroid hormones control the metabolic rate, the BMR, so the metabolism will be slowed down, and there will be lethargy, there will be obesity, there will be weight gain. In contrast to diabetes mellitus, in this case weight gain will be observed, and there will be mental dullness. Next up, skin related signs are most common and most important from Navle point of view. You will observe bilaterally symmetric truncal alopecia. So the alopecia will be present on the trunk. It won't be seen on over the head or the limbs, and the hair will come off easily, epilate easily, because they are stuck in a resting stage of growth cycle. So if the BMR, the metabolism is affected, it's affected at cellular level, and almost everything in the body is affected. So the hair growth cycle is affected, it's arrested at the resting stage, and that is why there's alopecia. Rat tail appearance is very important, very common. There's hair loss and lichenification of the tail. There will be hyperpigmentation of the skin overall. There will be lichenification of the skin. There will be seborrhea, which is flaky or greasy skin. There will be hyperkeratosis. So all these skin issues can be seen in case of hypothyroidism, and it's very, very important. It's sure short for Navle. Pyoderma can be seen. So hypothyroidism can predispose the dog to pyoderma, because if all the cells and their cycles are affected, then WBCs, the immune cells, the fighter cells, their function is impaired as well. Now the hair coat will be dry and brittle, so it will give a frizzy appearance. Another very important skin related sign is myxedema. Myxedema in severe cases. Now what is myxedema? Basically, the fibroblast means the skin cells that are responsible for producing substances that hold water like gags, hyaluronic acid, etc. The fibroblast functions are impaired. So the skin cells tend to retain more water and it's puffy. So this gives the dog a tragic facial expression, as if it's sad, because there are droopy eyelids. Basically a sad puffy face. Another observation can be otitis externa. So because of decreased metabolism, there will be higher chances of infection or otitis externa. Next one is cardiac signs. So the BMR is decreased, that means everything will be slowed down. Bradycardia and decreased contractility will be observed. Overall, everything is slowed down. Neuromuscular signs. Now, why are neuromuscular signs seen in case of hypothyroidism? Because there is impaired neuronal metabolism, or there might be compression of neurons due to myxedema as well. So the neuromuscular signs are seizures. There is polyneuropathy as well, facial paralysis, Horner syndrome, the weakness of muscles. All this falls under polyneuropathy. There will be ocular signs, that is corneal dystrophy, which means lipid deposits in the cornea due to hyperlipidosis. Animal is obese, there's increased amount of lipids, and that excess lipids are present in the plasma, the blood, and that will show up in the cornea. Now for diagnosis, blood picture will reveal hypercholesterolemia, normocytic, normochromic, non-responsive anemia. So this is very important. It was mentioned in vet prep as well. The T3 hormone stimulates EPO, erythropoietin production. Erythropoietin is a hormone produced by the kidney, and it is responsible for producing more RBCs. So if there is impaired T3 secretion, there will be decreased EPO or erythropoietin, and hence decreased RBCs, which means there will be anemia. But normochromic, normocytic, because the RBCs are normal, their size and the amount of HB that the RBCs contain, it's normal. So normocytic, normochromic, non-responsive anemia is important. Now the most important part for NAVLE is the specific diagnostic tests. The first one is serum T4. Serum T4 refers to both bound and free form of T4, and it has 20% false positive results. Because most of the T4 is bound and inactive, so the total T4 can decrease in other cases as well, like non-thyroidal systemic illness or drugs or stress. So serum T4 can be used to rule out hypothyroidism, but it cannot definitively diagnose the disease. It has misleading results. The second one is free T4 or FT4. Since free T4 is biologically active, so the body regulates it tightly. Hence, it is a much better indicator of hormones actually available to the tissues. It has 98% sensitivity and 93% specificity. Now, it's important to note that we cannot measure T3 levels. Why? Because T3, as we read earlier, it's only present intracellularly. It's not present in the serum or the blood. So the circulating hormone can only be analyzed in blood tests, and that is only T4. So we read serum T4, which was both free and bound form, free T4, which is more reliable. Now the third one is TSH concentration. TSH was produced by pituitary. And what will happen in this case? If in hypothyroidism the T4 levels are low, that means there will be a feedback mechanism to the pituitary, and the low levels of thyroid hormones will send a message to the pituitary that there's not enough hormone, you need to release more of TSH. So the TSH level is increased, not decreased but increased. This is important. Both T4 and FT4 decrease in severely ill dogs, but TSH values do not change in sick dogs. So if a dog is sick, we need to go for TSH concentration as well. The fourth diagnostic test that we have, it's response to empirical therapy. It's basically a reverse diagnosis. So what we do in this case is we give drugs for the treatment of hypothyroidism and observe if the animal is responding to it and getting better. And if the animal gets better, that means the animal was suffering from hypothyroidism. And after giving the drug, which we will discuss in the treatment part, there is a response in about a week. So there's a dramatic increase in activity and mental alertness. So the earliest signs of the improvement will be seen in the activity of the animal. The last and again very important part is treatment. So there's only one drug that we will read for the treatment of hypothyroidism, and it is a lifelong treatment. It is sodium levothyroxine. Levothyroxine is the important word. We start at 0.02 milligram per kg twice a day per oral. So it's given per oral. It's not an injectable. We need not to remember the dose rates. And T4 supplements are better because T4 can be converted to T3, but T3 cannot be converted back to T4. So I will repeat the diagnostic and the treatment part again. For diagnostics, there are 4 tests that can be done. First one is serum T4, which measures both the bound and the free T4. Second one is free T4. Third one is TSH. And fourth is the response to empirical therapy. The treatment involves only one drug, that is levothyroxine. The trade name is Soloxine. And the improvement time frames are as follows. There is dramatic increase in the activity within 1 week. The skin will improve next within a month. Then there will be neuromuscular improvement. In neuromuscular, we covered seizures, polyneuropathy, and lastly, reproductive problems. One last point to be noted is that we should be careful while anesthetizing hypothyroid dogs because they tend to be hypothermic. Their BMR is low, so anesthetic drugs may have more potent and long-lasting effect because of the slower metabolism. That's all for hypothyroidism.